Good afternoon, everyone. My name is Dana Chituvges. Along with my colleagues Gianluigi Muscato, Eileen Mandak, and Irene Estrada, I will be sharing with you this presentation about a vulnerable population that often remains invisible in our healthcare discussions, the immigrant mothers struggling with postpartum depression and the role of social support in virtual communities. Let me start with some numbers and statistics. When we look at postpartum depression rates among immigrant mothers, we're seeing prevalence rates between 20 and 34%. To put that in perspective, these women face a risk that's 4 to 6 times higher than non-immigrant mothers. This isn't just a statistic. This represents a hidden crisis in our communities, with thousands of women struggling in silence during what should be one of the most supported times in their lives. So, why are immigrant mothers so much more vulnerable? It's really a complex web of interconnected risk factors. Many arrive with previous histories of depression. They are often dealing with poor socioeconomic circumstances while trying to navigate a completely new healthcare system. Add to that the stress of complicated pregnancies or births in an unfamiliar environment, pre-immigration trauma that may still be affecting them, and the constant worry about relatives that they have left behind. Combining all those factors together, and we can see why these women are at such elevated risk. But here's where it gets really challenging. Even when these women recognize they need help, the obstacles to accessing mental health support are enormous. Language barriers aren't just about translation. They're about understanding cultural concepts around mental health that may not even exist in their home countries. Then there are the logistical challenges that we often overlook. How do we get to an appointment when you don't even have the reliable transportation or childcare? How do you access services when there are so few culturally adapted options available? And underlying all of this are economic constraints that make mental health care feel like an unaffordable luxury. Now let's talk about what actually works. Social support, and I'm talking about both instrumental and emotional support from family, partners, and community groups. These are absolutely crucial protective factors. When women have access to emotional validation, combined with practical assistance, we see significant reductions of postpartum depression rates. There's something irreplaceable about having someone who understands your experience and can offer actual help when you need it the most. But here where things get really interesting. The emergence of virtual communities as powerful support systems. What we're seeing is that these virtual platforms serve dual purposes. The mission side focuses on providing easier access to resources and practical information that women desperately need. But the vision goes deeper. We're talking about empowerment and building emotional self-efficacy. These aren't just information portals. They're spaces where women can develop confidence in their own parenting abilities. So how does this virtual healing actually work? These online platforms become spaces for what I call collective therapy through storytelling and active interaction. The 24/7 accessibility means that if a mother from one time zone is struggling at 2 a.m., she can immediately find someone to connect with, and it would be someone who understands and relates. The anonymous sharing reduces stigma, which is very important in communities where mental health issues might be a taboo. What we're really seeing is a reduction of isolation and the creation of genuine sense of belonging and sense of community. What this presentation clearly shows is that the most effective approach combines physical and virtual support. In-person networks plus virtual networks create enhanced protection that's greater than the sum of its parts. Technology bridges geographical gaps that traditional support systems simply can't reach. But here's the crucial insight. Culturally adapted content dramatically increases effectiveness. This isn't about translating existing programs, it's about creating genuinely responsive interventions. So how do we design services and policies moving forward? First, we need accessible community facilities. that are truly accessible, not just physically, but culturally and linguistically as well. We need to train professionals in cultural competency that goes beyond surface level awareness. Also, we need to invest in developing and maintaining culturally adapted virtual platforms. And we also need to expand screening and early intervention programs to catch the problems on time before they become crises. And the most important thing, we must include immigrant mothers themselves in designing these support systems because they're the experts on what they actually need. While these findings are encouraging, we still have significant knowledge gaps that we need to address. We need longitudinal studies to understand how maternal depression affects child development, especially in immigrant families. We also need to validate whether our current screening tools are culturally appropriate or if we need to develop entirely new instruments. We need to better understand the specific mechanisms through which social support provides protection. And last but not least, we have to perform more research on community-based intervention effectiveness in order to know what actually works in real-world settings.